Say thank you for allowing me this opportunity to speak today. This is my first speaking engagement, so I feel blessed to be here, so thank you. So again, the title of my speech is The Story of Plaque, Stop Telling Patients to Floss. When I tell dental patients that title, they smile, their shoulders relax, and they're inquisitive. When I tell dental professionals, they cross their arms, tilt their head sideways, and give me the disapproving glare. But have you ever considered we've been doing it wrong? Well, at least I had been for over half of my career. And I've been a hygienist for 17 years. I've been licensed in 3 states. I've lived in 7 states. And I've practiced in well over 24 offices. Some think I'm a nomad, some think I'm military, and others think I'm running from the law. One of those is true. I'll let you decide. But in all seriousness, in all these places that I have practiced, 3 scenarios often play out. The first scenario I like to call the confessional. That's where the patient comes into the office, they sit in the dental chair, and right away they confess to you, I haven't been flossing. Why, just a couple weeks ago, I had a patient come in. She had a big old cross necklace on, marching her way to my dental chair, didn't even make it there yet, and was confessing to me she wasn't flossing. Sometimes I feel like there's more confessions that happen in the dental chair than in church. So the second scenario that I often see is what I like to call the canned response. The patient sits in the chair, they wait for you to ask, how often are you brushing and flossing? And their canned response is, not as often as I should be. Have you heard that before? And what does that really mean for us as professionals? The third scenario happens, but doesn't happen as much, thankfully. But this is where the patient comes in, sits in your chair and says, I don't floss, I'm not gonna floss, and I don't want your lecture. And really, in all 3 of these scenarios, and the patient that no longer comes to the dental office, what is it? It's shame. We've been shaming our patients, or at least I had been. I had been when I would say, if you don't floss, you're gonna get gingivitis. If you don't floss, you're gonna get periodontal disease. If you don't floss, you're gonna lose your teeth. And then I wonder why they came back and their confession changed a little bit. I scared them. And their confession would change to, I did really good for 2 weeks, and now I'm not flossing as much as I should be. You see, I felt like I was a trapeze artist. I was swinging from that first bar, trying to catch the next bar, and every time falling flat on my back, looking up going, what did I do wrong? I told them to floss. I told them what would happen if they didn't, and I was still missing it. And so I decided to step back and take an objective view. And I came up with 3 rules for my operatory. Rule number 1, it's not a confessional. No confessions allowed. Rule number 2, no F words allowed, unless it's to encourage or uplift. And rule number 3, I won't teach you by scary diagnoses. Coming up with these rules was good, but I still needed more. And I thought, what if patients actually understood plaque? So I came up with the story of plaque. And I started explaining in layman's terms what plaque meant to patients. And I started noticing a difference. And I thought, well, what if I wrote a book? So I did. Very simple book that I placed in my operatory. The Story of Plaque, Stop Telling Patients to Floss. Patients walk in, they look at the book, and they say, you mean I don't have to floss? And I say, no. If you know the story of plaque, I won't have to tell you to floss. You'll want to. Right away, they want to know the story, and you probably do too. So we all eat food. We get plaque on our teeth. Plaque is living bacteria for 24 hours. That means if I took some off my teeth or your teeth, and we looked at it in a microscope, you'd see it crawling around like a little tadpole for 24 hours. After 24 hours, it hardens and dies. If it's hardened up underneath the gums, it's the same as having a splinter in your finger. Your body reacts the same way. It gets red, tender, swollen, and in your mouth bleeding. That is the definition of gingivitis. Gingiva is gums, itis means swelling. Just like the splinter in your finger, if you remove it, it gets better. Gingivitis is reversible. The story doesn't always end there, however. Think of barnacles on the side of a ship. It keeps building and building. Every time you eat, you get more living plaque bacteria. That bacteria is giving off just a little bit of acid onto your bone, causing it to slowly melt away. You don't feel it because bone has no nerve endings. What you notice instead as the patient is you smile and you notice your teeth are longer, you can see more recessions, and you have more sensitivity. This is called periodontitis, or you know it as gum disease, and it's irreversible. It's treatable, it's maintainable, but it's irreversible. When I tell patients this story, they often turn to me and say, well, where am I at in this story? It's the perfect opportunity to use our evidence that we already gathered in that appointment. Radiographs to show bone loss, probes to show probing depths, bleeding, furcations, mobility, intraoral photos to show what's happening directly in their mouth, how it relates to them. I have found when I do this, patients are very compliant. And so I think of it like when I was trying to get into hygiene school, I had to take a chemistry class. And the chemistry professor had a PhD in physics. That means he was really smart. He had a hard time bringing it down to the chemistry level, which meant I spent many hours in the library breaking it down into bite-sized pieces that I could understand to pass that course. We, as the dental professionals, are the PhDs. We need to break it down for our patients so they understand what's happening in their mouth. I also feel like it's not enough to just break it down like that, but also a demonstration. How many of our patients have been handed a toothbrush growing up and that's it, and told, brush your teeth? What does that mean? Imagine this, you're in a room, there's an instructor in the front of the class, you're all seated at a desk with a white sheet of paper in front of you. The instructor tells you, close your eyes, fold your paper in half, fold it in half again. Tear off the lower right corner of that paper. Flip it around 3 times. Now draw an A in the upper left corner. Now everyone open your eyes and look at your papers. As you can imagine, everyone's paper is going to be different. It was all perception and very vague instructions. That's the same for brushing. That's the same for flossing. So it's our job to bridge that gap and to help our patients understand how to do this. So what I have done is I've given my patient a gift. I didn't scold them, I didn't lecture them, I handed them a gift and said, this is where you're at, here's what you can do about it. And I will tell you, I am that trapeze artist that's catching the bar one after another, and that's why I'm here to tell you, like, do it, if you do it just a little different, it works. I have patients coming back saying, in 45 years, this is the first time I haven't bled. In 6 months, this is the most I've flossed in my whole life. This is the healthiest my gums have ever been. And so, if we've helped them to do something like this, just flossing, imagine the sparks we've ignited for them to do anything else. Anything is possible. And to end with a quote from an author, Dodinsky, sometimes people will hear you better if you speak with a voice of compassion instead of authority. They long to be understood and not lectured. And now I must go. It's the police. Thank you.